Welcome back to the Returning to Activity After Anterior Cruciate Ligament Reconstruction Surgery educational program. This is the third unit where we will be discussing physical therapy and rehabilitation following ACL surgery. Following an ACL reconstruction surgery, most individuals will have pain and swelling in their knee, which results in a loss of range of motion, strength, and coordination. Physical therapists are individuals who have been trained to help patients recover from ACL reconstruction surgery and regain things like strength and range of motion and coordination. While the time course for different anterior cruciate ligament reconstruction surgery rehabilitation programs vary, they are typically around 6 to 12 months, with people usually returning to sport at around 6 to 9 months, and they generally follow the same progression. The first stage of rehabilitation starts with focusing on regaining range of motion, typically during open chain exercises, where the foot is not in contact with the ground, and we will go over some of these later on. This will be followed by slowly being able to bear weight and moving towards more closed-chained activities, where the foot is in contact with the ground, such as squatting or step-ups. Once range of motion and strength have regained to a certain point, the physical therapist will slowly start to introduce unilateral weight-bearing tasks, walking and jogging, and you'll be followed by light dynamic tasks such as counter-movement jumps. The last stage of rehabilitation usually heavily emphasizes sports-related movements, including jumping, hopping, cutting, and they typically involve multiple planes of movements, such as jumping forwards and backwards and side to side. We've mentioned and talked about pain previously and how it can be hard to separate pain from discomfort or anxiety. This results in a large difficulty in quantifying pain, which is typically done on a visual analog scale, where the patient will subjectively indicate what their pain level is from none to the most excruciating pain that they have ever experienced. As you can imagine, this method of quantifying pain has a large amount of within subject and between subject variability, so it's very subjective. Remember, for this study, we are defining pain as the discomfort, both physical and mental discomfort, directly associated with your injury, and not normal soreness or weakness due to exercises. After surgery, you will have a full leg brace on, which essentially serves the purpose of immobilizing the knee. Also, you will be given crutches so that while moving around, you can prevent putting your full body weight on the limb. Now, crutches and knee braces are important to limit the amount of weight you'll bear on this limb, which will limit the amount of stress and strain that is transmitted through the knee joint and likely the ACL graft, which has just been put in, and this will give it time to heal and regain strength. However, the knee braces and crutches are also a good tool for managing pain, as putting weight on your limb will be very painful, and so avoiding putting weight on your limb early on in rehabilitation is a good idea. However, avoiding putting weight on the limb for too long can cause muscle atrophy and actually delay the healing process. So it's important to start gradually putting weight on the limb as pain allows and under the supervision of your physical therapist. Once you're allowed to bear weight on your limb, you have good quadriceps contraction, meaning that you're able to contract your thigh muscles without having it hurt, and you're able to move your knee with a good range of motion. The full knee brace is typically removed. As we mentioned in the first lecture, most people have difficulties walking when recovering from an ACL reconstruction surgery. And so regaining normal walking patterns is something that is heavily focused during rehabilitation. We mentioned that common signs present in ACL reconstructed gait is difficulty bearing weight with lower impact forces on the surgical limb and a more flexed knee posture throughout the gait cycle. And we talked in the last lecture how these changes affect the contralateral or uninjured limb, and how this results in an asymmetrical gait pattern, which is seen as bad for both the healing surgical limb as well as the healthy uninjured limb. We mentioned that this is the results of what we call quadriceps avoidance, where these individuals have adapted their walking style to avoid using their knee as best they can, which is a protective mechanism to try and shield the healing joint, like we talked about earlier with the crutches and the weight bearing. You're trying to use this limb less so that less forces are transmitted through the joint and through the healing tissues. And while this is intuitive, as placing body weight on the limb may be painful, this can actually slow down the healing process by decreasing blood flow and slow down improvements in strength and range of motion. And so it's important to walk as symmetrically and normally as possible as long as your pain allows. And this will assist in accelerating recovery and function of the limb. So we mentioned that the swelling that occurs after surgery will impact your range of motion and strength and pain. And so reducing the swelling is another thing that is very heavily focused on during rehabilitation. And this can be done in many different ways. So remember, swelling isn't necessarily a bad thing. It's the body's natural way of flooding the joint with nutrients it needs to heal, as well as casting the joint, which helps to stiffen the joint much like the cast was early on in rehabilitation. However, during recovery, it's important to help your body in reducing the amount of swelling so that normal progression of healing can occur. Traditionally, cryotherapy, or exposing an injury to a cold environment such as icing something, is one of the first things thought of when reducing swelling. However, it's been shown that the addition of compression while icing an injury can significantly increase the benefits of icing an injury alone. For example, a recent study took two groups of individuals recovering from an ACL reconstruction surgery. And this study had one group ice their knee during recovery, and one group use a compression cooling device like the one seen on this slide, the Game Ready sleeve. This study found that the group who used the compression cooling device had significantly higher improvements in range of motion, pain, and subjective knee function. So this shows that the addition of compression while you are cooling the joint may accelerate the decrease in swelling and improvements in range of motion, pain, and general knee function. So this Game Ready sleeve is a common example of a product which does this. It compresses the joint and cools the joint at the same time. We also talked about muscle strength in the first lecture and mentioned how people recovering from ACL reconstruction surgery typically have muscle atrophy, where the volume and strength of their quadriceps muscles typically decreases as they are immobilized and recovering from the surgery. And so regaining muscle strength is an important step in rehabilitation to improve and return to your desired activities. Blood flow restriction is a new and emerging technique where a pressurized cuff is placed on the upper thigh that reduces blood flow to this distal portion of the leg. So it will reduce muscle to the quadriceps and hamstrings as well as the calf muscles. And so this blood flow restriction has been shown to prevent both muscle loss and accelerate recovery of strength. Interestingly, this technique has been shown to be effective when applied to a completely immobilized limb, as well as when applied to a low-intensity resistance training following ACL reconstruction. The exact mechanism by which blood flow restriction results in beneficial muscle adaptation is currently unknown. However, for the time being, it appears to be a promising approach to improving muscle function following ACL reconstruction surgery. The use of knee braces in ACL reconstruction patients has been around since the 60s and started with Jets quarterback Joe Namath and has since grown in popularity. Today, almost 70% of orthopedic surgeons have their ACL reconstruction patients wear knee braces during rehabilitation and activities. The purpose of knee braces are to try and prevent excess movement or stress from being placed on the joint, or preventing your knee from moving the wrong way. Another purpose is to prevent full knee extension during sport. As we mentioned in the previous lecture, landing on an extended limb can be potentially harmful to the knee joint and the ACL specifically, and so many of these knee braces are what we call knee extension constraint braces, which would prevent you from putting your knee in full extension, which is primarily useful during sport. While there are many off-the-shelf braces, most of them nowadays are custom fit to an individual, which will improve its comfort and function. While, like we mentioned, most surgeons suggest wearing knee braces, their efficacy or usefulness has been debated. For example, recent studies have not found that they reduce strain placed on the ACL, and recent clinical trials have shown that two groups of people who wear braces during recovery and people who do not wear braces, do not necessarily have significantly different strength, range of motion, and ability during functional performance tests, such as the single leg hop. And so this indicates that it may not be improving or completely necessary to wear a knee brace during recovery. However, on the other hand, previous studies have shown that during sport-specific activities such as jumping and hopping, people wearing knee braces on their reconstructed limb seem to move better and might be a little bit more confident. And so there is still a continued need to study brace use in ACL reconstructed patients. However, for the time being, wearing a knee brace during activity is probably a good idea, and the best idea would be to listen to your orthopedic surgeon's advice. Another common question is, how long do you have to wear your knee brace for? Brace wear is likely most important early on in rehabilitation and return to sport to prevent excess strain from being placed on knee joint structures and prevent it from moving in the wrong way. A recent survey of the American Orthopedic Society for Sport and Medicine revealed that 63% of orthopedic surgeons prescribe functional knee braces to their patients, and out of these 63%, 71% had their patients wear braces for up to 1 year following surgery. So this seems like a pretty good amount of time to be wearing your knee brace, about 1 year. However, this decision has also been debated, as another previous study found that individuals who wear their knee brace for over 1 year have significantly decreased muscle strength compared to those who do not wear or wear less than 1 year, showing that this may induce some adaptations that are potentially maladaptive to muscle strength. Another problem is improper brace fit. If a brace is loose, it may not provide its intended protective benefits, as well as it could be quite uncomfortable. And this can happen often with ACL reconstructed athletes as they return to sport. So when you're returning to sport, you are likely still regaining muscle strength, and so if you're fitted for an ACL brace and then you continue to gain muscle strength and muscle volume, your thigh might become bigger and the brace might not fit as well. Early on in physical therapy, it will still be painful to bear weight on the healing limb, and so open chain exercises are frequently utilized. Here you can see someone laying on their back and flexing and extending their leg. So this person is flexing their leg or pulling their leg closer in and then extending the leg and repeating this in a cyclic motion. And this is important as it will start to promote blood flow and reduce swelling, as well as improve range of motion and start to regain muscle strength. So the difference between open chain and closed chain exercises is that Open chain exercises are typically done without bearing weight on the limb. So you can see the leg is up in the air in this instant, and by doing this you can individually move one joint and not the other. So this person can flex and extend their knee while not moving their ankle or not moving their hip. Whereas during closed chain exercises, the hip, knee, and ankle are all interdependent. So during a squatting movement, you are going to be simultaneously flexing your hips, knee, and ankle. Whereas during an open chain movement, you can just move your knee. Other common open chain exercises is knee extensions while you're sitting, which actually can be weight bearing, such as knee extension, the knee extension machine at the gym. Regaining normal range of motion early on during rehabilitation is very important to accelerate rehabilitation. While we mentioned that swelling after surgery is not exactly bad, as it does serve the purpose of healing damage induced by the injury, this swelling can induce scar tissue that can impact range of motion. So it's important to try to reduce this amount of swelling and regain range of motion. Studies have shown that loss of knee extension as well as limited patellar motion can impact joint mechanics following surgery, with your patellar being your kneecap. So your reduced kneecap range of motion can also be an important factor, as well as your knee angle range of motion. These limited range of motion can change your quadricep function or your thigh muscle function. It can inhibit the effectiveness of your quadriceps to produce motion, as well as it's believed to alter joint contact forces, which may result in early development of osteoarthritis. So it's important to work at regaining range of motion early on in rehabilitation to prevent this scar tissue from really forming and setting in, and long-term decreases in range of motion. However, you shouldn't push yourself too far, and this shouldn't be necessarily too painful. It is possible to overdo it and hurt your knee even more by forcing it too far into extension or forcing it too far into hyperflexion. Also, you should not try to twist your knee or bend it sideways, as these are not the joint's intended directions of movement. We've talked a bit about muscle strength following ACL reconstruction surgery and how that is heavily focused on during rehabilitation. All ACL patients will have some sort of quadricep weakness following surgery, and it's important to work on this during rehabilitation prior to return to sport. Muscle weakness has been associated with limb asymmetries during dynamic sports-related tasks such as jumping and hopping, which has been in turn related to further complications and further knee injuries. There are many different techniques for improving muscle strength, and you should be careful not to progress through them too quickly. Passive muscle strengthening is done through the use of external muscle stimulation, which we'll talk about in a minute, where the muscle is activated for you. On the other hand, active muscle strengthening is what we typically do when we are working out or exercising, where your muscles are activated under your own control. We've talked a bit about open chain and closed chain exercises, with open chain being where the foot is in the air, such as someone laying on their back or doing a knee extension machine. Closed chain exercises are done with the leg in contact with the ground, such as squats or step-ups. And again, these are considered closed chain as the hip, knee, and ankle all move together during these movements. Your progression through these exercises will be dependent on your level of pain and ability, and you should listen to your trained physical therapist and not try to push yourself through these too quickly. Closed chain exercises typically bear more weight than open chain, so this could be painful. However, some open chain exercises, such as weighted knee extensions that I talked about, will also place a lot of strain on the joint and could cause a lot of pain. So I just mentioned that passive muscle stimulation could also be used to help regain strength, and here's an example of passive muscle stimulation called electrical stimulation, where you'll see a positive electrode placed on the upper thigh and a negative electrode placed on the lower thigh. And what these will do is cause an electrical stimulation to be sent through your thigh muscles, which mimics an action potential, which is the electrical signal sent from your brain down to activate these muscles. So these electrodes, in essence, activate your muscle for you, and these can be helpful for regaining muscle strength as well as regaining full knee extension range of motion. By modulating the frequency and intensity of the implied stimulus, different muscle groups and contractions can be elicited. Thank you for listening to the third unit of the ACL Reconstruction Return to Activity educational program. Please close this video and return back to the link that was sent to you via email to complete the short quiz, which should be 3 questions regarding today's material. Thank you.